Hey guys, this is Greg with Medical Muscle. I just want to make a brief video on the SGU requirements for clinical rotations. Now, just be aware that some of these things may be hospital dependent, so just something to keep in mind. But I think for the most part, it goes across the board regardless of the hospital. So, first thing, when you're in a core rotation, peds, OBGYN, internal medicine, surgery, any of those, psych, you're going to be doing Firecracker. So Firecracker is just another testing company. They have their own style of questions. You have to do a weekly quiz. It's pretty easy. It's like, I think it's 25 questions, something like that. You have to do it every week. And I think you have to, at least try. I always put in my best effort, usually, because I would use it as just kind of a gauge if I was understanding some of the material, but I didn't, study for it or anything like that. You're not graded. I don't think you're graded on, your score. I think it's just, something to just keep you in mind that there's certain topics that you may have to cover. There is not a lot of crossover with the style of questions that Firecracker asks to UWorld or NBME, any of those other testing companies. So, I know some other students that have used Firecracker heavily and did well on exams. So, it's got some application, but I just felt like there was better resources out there. I think UWorld and NBMEs, practice NBME exams are a lot more helpful for your shelf exams. And there's flashcards on those. I didn't feel that they were super helpful. I felt like, sometimes there was little bits of information, but I don't know. Medicine evolves constantly. And I felt like there might have been discrepancies in the first line between the testing companies. So that's something to be aware of. Okay, so Firecracker, weekly quizzes. You have to do every single one every week. Do not miss it. It could be a big problem to your professionalism. Okay, now, direct observations. Direct observations are like a little form that you hand, a resident or an attending, and basically you're being scored on your ability to do, an HPI physical on a patient. It didn't count for our grade. There was no grade. It didn't affect our grade if we did poorly on it, but it just kind of gives you an insight, like what you need to work on. Were you taking too much time with the HPI? Were you being sensitive to their condition? I felt like it was not a great assessment of my skills or things like that. But it's something that you have to do for SGU, and you upload those. Now, patient logs. Okay, so every rotation, you have to see a certain amount of conditions. They put them in there. So like say for surgery, you have to see like a pancreatitis. You have to see a certain amount of cholecystectomies or appendectomies. You have to see those things. Or an OBGYN, you got to see at least 2 C-sections or something like that, which you'll see a lot of these. And if you don't, you would do the iHuman thing, an online thing. But they just want you to just document, brief documentation of all the things that you've seen for your own knowledge. And you'll be surprised at the variety of stuff that you'll see. Like a lot of the stuff you've covered in term 1. Some of the strange genetic conditions that you thought you'd never see, you actually see a lot of. It's really weird. So, you have, on top of that, for each rotation, we usually had a case write-up. That was pretty common. So some kind of case write-up and presentation. There was variation to that on what that entailed, but in general, for every rotation, we had about 1 or 2 patient presentations, okay? You'll just pick a patient that you thought was interesting, and you're just gonna present their case, and then people try to figure out what the diagnosis is. With those cases, it's really important to write like a doctor. Sometimes the preceptor that is grading you on these presentations will not have a chance to work with you in any other capacity. So their one-on-one interaction with you is during these presentations. So you want to make sure everything is clean, concise. You're looking through all the patient's notes. You have all the information, and also pick an interesting case that you think everybody else is going to find interesting, or that they can apply to their own study. Because sometimes there's a topic that you find for a specific patient of yours that's something that you have seen a lot in UWorld or something. So that's something to consider. All right, and then on top of that, for IM, and I think actually they're starting to incorporate this with all rotations. For me, we only had to do this for surgery and IM, but I think where they're doing this for all specialties, or maybe some of them, there is a progress exam. SGU gives you an exam that you got to take halfway through the rotation to get an idea of how you're doing. I can tell you, I know some students who I didn't do very well on one of them, and the actual exam, I did really well. So I don't necessarily think those halfway exams that they administer are that representative of how you're actually going to do on the NBME. There might be some correlation, I don't know, but that wasn't the situation for me or anybody else that I talked with. I know people that had failed it the halfway, like if they were actually great on it, they would have failed it. They got like less than a 60%, but they ended up getting honors on the shelf. So there wasn't a correlation. I was reminded during these exams, these halfway shelf exams, that SGU style questions are maybe kind of on the easier end. And when you face the actual question in UWorld or in NBME, it can be a lot more difficult. So that was another factor that I thought, this might not represent exactly, what you're actually going to see on the shelf exam. Okay, but it just gives you an idea. It's good. It's good to cover it. You get to. It's just more questions. Hey, it's just more questions. If you remember a specific topic from taking that little exam, then it's helpful. And on top of all that, you have evaluations. Okay, so that's how you get your grade during the rotation. That's actually probably the most important part. So, your presentations during the grade, so doing Firecracker, completing those, doing the patient logs, doing your direct observation, that's all for your professionalism. It's just stuff that you have to complete. It's actually pretty easy, I think. But the harder thing is to really impress the attendings that you're working with, so that when you're getting these evaluations, you give them the form, they can give you an excellent one. It's hard to get a perfect one from everybody. Sometimes people are in bad moods, it seems like, and they just give bad scores. Sometimes I've dealt with attendings that didn't seem like they were in a particularly nice mood, and they gave me an excellent evaluation, or some were in an excellent mood and gave me a poor one. Sometimes you can't read it that way, but it's just important to study really hard as you can, so that on the rare occasion you get asked a question, you can answer it. Because sometimes that's it's like the one thing you said during rounds is what you're going to be graded on. You never know, and I feel like, people sometimes they have to fill those things out, and they haven't seen enough of you. So they're going to base it off of just what they've seen so far. Okay. It's rough. It's really rough. It's really subjective. It's very subjective. Your evals are very subjective. So in general, just I would get the evals from people you've worked with a couple days, you have good rapport with, so they can get a better whole picture of you, not just the one day where you made a few mistakes. You don't want to, maybe do that. Don't give the attending that eval that day. Maybe wait a little bit until they get to see the true you and your whole ability. Stun them, show off how good of a student you are. All right, guys, I hope that was informative. This ended up being longer than I wanted it to, but hey, if you have any suggestions, go ahead and leave a comment down there. And hey, please subscribe, like, this video and stay updated for more content.